Hello everybody!
Hello.
So today I have invited these three beautiful people here. We're going to see the real reaction of first trying acupuncture. So before we start, let's first introduce them.
Okay, hi, I am Salvatore and I'm from Italy, and I do as builder is my job, and I'm gonna try acupuncture today for first time with her, and we're gonna see like the feeling that we feel, and we're gonna see it.
Okay, and you?
Yes, my name is Koshin and I come from the Middle East, and I was raised up in Sweden. I started traveling like 2.5 years ago after I was working as a lifeguard, but working in the plastic paradise made me want to travel the tropics. So here I am, adventuring medicine.
Hi, my name is Beth. I'm from China, and when I grew up I tried a lot of Chinese medicine as a kid, but I've never tried acupuncture, so that's why I'm here today.
Cool! So could I ask you guys some questions at first? Like, how do you feel when you first hear the word needle? Usually.
Okay.
Scary.
Scary.
It's scary.
You're okay with it?
Yes, I'm good.
Yeah. And what about you?
So growing up I was afraid of needles, but I had to grow strong and take them, you know. So
Okay.
here we are.
Alright. First of all, I will show you guys some different sizes of the acupuncture needles. So this one is very tiny, and you could actually have a look at it. Like, yeah, take it out. And, yeah. So this is the handle of the acupuncture needle, and this is the body and the tip of the needle. There are different sizes by length and diameter, and this one, like by size, it's bigger and longer and thicker. So usually I would choose the bigger ones for musculoskeletal pain, but I mean bigger relatively, it's still very fine compared to those injection needles in hospitals. Yeah, and smaller ones could be often used for some internal problems, and even it's friendly to babies and kids because it's small and it's like nearly painless. So there are different types of acupuncture needle insertion, but today I will only show you two types. One is most commonly used by most practitioners around the world. It's called tube guided insertion. So it's as how it sounds like, with a tube. And usually we push it firmly on an acupoint. So you just imagine this is the skin, and then we take this out. So a tube guided insertion is like you just tap or flip the needles in. Then if it's skin, it's easy to get in, and then it will penetrate the skin easily. And you just take the tube out and the needle would be inside the skin. But you need further manipulation as required. So this technique is quite easy for beginners because you can see it's very easy to practice and learn. Yeah. So, but it has some limitations, like for example, if it's on like scalp or area that without a lot of thick muscles, this flipping would be a bit painful, and you can't control the depth of it easily, and also it loses some essence of the traditional Chinese medicine. During my practice, I often use the flying needle technique. So what is flying needle? So I will show you where we practice. Okay, so could I ask you guys, like, what's the first impression of acupuncture? Like your first impression?
So I've heard about acupressure, and I wanted to experience the needles as well. And to feel the difference in between. And I've heard that these are more intense feelings when you put them in. And I wasn't too sure about doing it on myself the first time, and that's why I went to professionals.
Ah, cool.
Yeah.
And you?
My impression when I heard acupuncture. Well, I know what is acupressure, so I wasn't very like impressed, you know, like something like scared. I was more like curious, you know, to know more about this, because I do believe that Chinese medicine is one of the, like, not the best, but it's one of like very good medicine, and I want to try. So my impression was quite like positive. Yeah, positive.
Okay. How about you, Beth?
Well, growing up in China, I always know about acupuncture, but it just never occurred to me to like try it.
Oh yeah?
Yeah,
So
I don't really know much about it.
okay, cool. So right now, the best part of this video today. Okay, so we're going to use. I'm going to apply these two techniques on you guys. We can do a comparison to see which technique you like more. So first, I will show you the tube-guided acupuncture needle insertion. So just flip, and it's inside. How do you feel? Any pain?
No.
You can say yes if there is any
No,
pain.
I didn't feel it.
Yeah, okay. And now I'm gonna manipulate the needle. So it's the second step of having an acupuncture needle insertion, which means I will put the needles down a little bit. Sometimes you might feel some sensation in the local area, but sometimes it could travel up or down. Yeah, it depends. In Chinese medicine, we think this is the qi conduction. So in Chinese, it means qi 的传导. But in modern science, they have found that the tip of the acupuncture needles could activate afferent fibers of the nervous system, which give us this kind of sensation. Okay. What are you feeling right now? Any pain or anything?
No pain. I just feel my arm very light. Like I feel like it's floating.
Okay, like going down?
Yes, yeah, going down.
Okay. So the second technique is the flying needle technique. Yeah, so this one, I actually personally prefer using this one. So you just inject the needles with your hand, like that. And how are you feeling?
I didn't
Same
feel,
or?
I didn't feel any pain. This was like pain free.
Most acupoints after needling doesn't really bleed, but I mean you can't avoid, some of them might, but mostly it doesn't. So that's how small and tiny the acupuncture needles are. This one is a bit scared and nervous, but I will show her it's not that scary.
Okay.
Is it pain?
No.
Okay. What about now? Do you feel anything?
Yeah.
Yes. How's that?
When you put in, it feels a little bit things, but now it doesn't feel like anything.
And also, all the acupuncture needles are sterile already in the package, and it's disposable for just single use. The feeling could change, depends on the size of the needles. So if it's a bigger ones, you might feel more, but it's a smaller one, it's like less. Yeah. So this one is a bit different from the ones that use on self-tool.
Yes.
Yeah. It's a little bit.
Bigger.
0.05 millimeter thicker.
Let's do it.
Yep. Okay, and you can relax your arm. Yep. So first the tube guided needle technique. How do you feel? Any
Good.
pain?
No.
And I'll put it a bit deeper.
Mm-hmm.
Okay. Are you okay?
Yeah, I was waiting for the pain, but there was nothing.
I'm waiting for the pain. So this is the flying needle technique.
I feel good.
You feel good?
Yeah.
Okay. So I do need to mention that about 2 to 3% of the patients might faint away for the first treatment. It's mainly due to their being too nervous or too hungry or too weak before they come to an acupuncture treatment.
I can really feel something, yeah. But I can't point to feeling if it's pain or it's like...
Yeah, it's like a interesting
Yeah.
sensation, I can
Yes.
say. I can feel the sensation. I can call it like a pleasant pain, if that makes sense.
Yes, pleasant pain,
Yeah.
yes. Is this the biggest needle you have, or do you have...
Oh, okay. So, right here, this. He asked, "What's the biggest needle?" I mean, this is not the biggest yet, but it's quite big. We usually use this for like muscle, like areas that with big muscles, like our buttock or thighs, sometimes lower back. Yeah. So today, you guys all have tried the feeling of acupuncture needles. And do you have any questions?
Yes. So, for me, it was when you put the needle, it was like an emotional attachment to it, that it felt a little cold, warm, and it was a release when it come. It was not a unpleasant feeling. It was more a comfortable roller coaster, I would say.
To this, like, I mean, first trying acupuncture needle and you feel less nervous or scared of the needles, will you be keen to try a full acupuncture treatment in the future? Things like that?
Definitely.
Yeah, definitely. If it's like in an earlier stage, it's usually easier to be treated. But if it's there for a long term, you might need more courses of treatments, and also we combined acupuncture with Chinese medicine together to help.
Does it fix a problem, or do you have to keep going back for like regular treatment?
I think it also still depends on the patient. Like we can't guarantee that this will 100% fix your problem, because it depends on how bad you have that problem. But usually it could make quite a good improvement of the health problem. During my practice, I often advise my patients to do self-care and exercise. So acupuncture treatment could do 60 to 80%, but the other 20 to 40% you need to know how to maintain your good health. Yeah. So if you come for like a lower back pain and you feel relief after a treatment, and then you go back home and you drink alcohol, you go to do like high intensity exercise without like taking care of your back, definitely you will get worse again.
Yes.
Yeah, so that's like the way that you know how to keep the effectiveness of the treatment, and how to take care of yourself is also important. Yeah.
Well, I saw in one of the video clips that I've been watching over the internet that there's one that puts it in the middle of the eye.
Yeah, yeah.
And I would love to try this. It was the last level, like if I could do this and do that,
Yeah.
I would love to try in the
Oh.
middle. And they said it was gonna feel a little different to do it in that point.
Do you know what this point is like for?
I've heard about that we have the chakra points and we have a lot of nerves going on there. So I would love to learn more about it as well.
Okay, so this one we usually use it for calming your mind. And if you were like stressful, or sometimes you have insomnia, like hard to get to sleep. So here nearly comes to an end. So after you guys have tried, like first time trying acupuncture, and have you changed any opinions towards needles or acupuncture?
Yes. So I thought there was gonna be pain involved because I've seen the videos of people being very like nervous, and I'm surprised that I didn't feel anything at all, and that was more a sensational experience than something you have to feel.
Yeah, I thought it's gonna be painful, but it's not, and it's a strange feeling. But it's not bad. I think my impression of acupuncture definitely improved, and I might try it again if I have some problems.
Yay!
My impression is okay. In the beginning, I thought that as cousin that it was a little bit pain, you know, but I didn't feel any pain at all. And now I also feel like more relaxed, you know, like I feel more like not slow, but like my mind is very like quick, but my body is like relaxed.
The reason that I make this video today is just to want to tell people that you don't need to get freaked out when you hear acupuncture or when you see the acupuncture needles, because in reality they don't really hurt that much. I mean, for some points they might cause some feelings, but it's all acceptable and you don't need to get nervous about it at all. And because it could also benefit a lot on our health, so just give it a try. Thanks for watching. If you like this video, please give us a like, comment, share and subscribe. I'm Karen with a C.